Good morning, everyone, and welcome to the Advocacy webinar on Tuesday, March 13th. My name is Brittany Sandage, and I am speaking to you from the Prevention Action Alliance headquarters in Columbus, Ohio. It is a very chilly day. I hope everyone has stayed safe and warm in all of this crazy weather. As an honorary Buckeye, I'm still a little bit in shock this lovely March and waiting for the sunshine to come back. As many of you know, we are currently without our executive director. She is on a much well-deserved vacation. So I will be bringing a few updates to you today, and then we're going to hear from a guest speaker. As we move through the webinar today, please remember you can send any questions or any notes on any technical difficulties to me through the question box. As always, we are recording the webinar. It will be available by the end of business day today, and you will receive an email follow-up with your certificate of attendance and your hours after the webinar is complete today. So without any further ado, I want to jump in just a couple of quick reminders. In terms of things that are going on here in Columbus, there's not a lot to report at the moment. We are watching some of the previously discussed conversations that are happening in the sessions right now, monitoring things, but for the most part, we're seeing a lot of our legislators in conversation, going through data, and just kind of keeping our hand on the pulse of that at the moment. Those sessions are going to continue through April, and so we are going to, as the month goes on and as we prepare for Legislative Day, which the Ohio Youth-Led Prevention Network and Statewide Prevention Coalition Association will be taking part in next week. We will continue to keep you updated. As I'm sure many individuals have experienced in their local communities, we are getting a lot of questions about some of the better ways that we can be mindful of mental health and wellness promotion in our conversations with community leaders, both locally and at the state level. We've been in partnership here, Prevention Action Alliance, conversations with some partners, NAMI, the Ohio Suicide Prevention Foundation, and various others, pulling together some talking points that we will be sharing with you as we organize them and as we make them more keenly available. We know that a lot of communities are currently dealing with trauma and conversations around the various tragedies associated with gun control and bullying and suicide. There are just a wide number of things going on across the state, and we're trying to make sure we're working with our partners to get you some of the better tools and resources as we move forward. So if you do have particular resources that you think would be helpful to other coalition leaders, please share those with me. In addition to that, if you have any identified needs that we may not have thought of, please don't hesitate to share it. It can't hurt in the conversations that we're having with our state partners. Another opportunity I wanted to make sure to bring attention to, we recently saw a release from the State of Ohio Board of Pharmacy. Through the CARA funding, the Department of Mental Health and Addiction Services and the Board of Pharmacy are providing drug disposal boxes to communities through Ohio law enforcement agencies. I have clicked through just to kind of check things out. Right now, the public-facing message is that applications need to be received by April 2nd. On the survey link and the application, it does indicate that communities should try to submit that by March 30th, and I would encourage you to do that earlier rather than later. If you are looking for additional information to pass on to your law enforcement partners, you can certainly reach out to Allie Simon there on screen, or certainly reach out to us here as well. Happy to provide any documentation or some talking points that speak to why drop boxes are important. But it is a good resource. If your community is one without a drug disposal box, I would encourage you to take a look, start the conversation, and see if you can apply and potentially get some of those resources into your local community. Coming up here in Columbus next week, we are very excited. In lieu of the traditional SPECA meeting, we are hosting the two-day mini conference, which is called Coalitions Rising, Better Policy and Practices for Prevention. As many of you know, we have already publicized much of the agenda and some of the keynote speakers, but I wanted to bring attention to a couple of points and indicate that most of these resources will be available to SPECA members after the event in terms of any of the handouts and any of those types of things. But in light of our medical marijuana program here in in Ohio, knowing that communities are asking for some additional information on how we can better canvass communities and better set the stage for good prevention moving forward. We do have 2 marijuana-oriented keynotes planned, one on Monday and one on Tuesday, March 19th and March 20th. On March 19th, Dr. Bridget Freisler will be presenting to us the various ways that we can use mapping technologies, environmental strategies, and various other resources to look at and establish baselines for data at a local level. So this should be a really interesting way for us to get a sense of what community groups can do from a grassroots perspective to monitor and understand the impact that marijuana may have on local communities, and to put some talking points in place for how we might be able to move forward, to watch for things, to think of new strategies that we need, new resources that we need. So very excited to hear her speak. And then on Tuesday, we will be hosting a panel facilitated by Marcy Seidel, our executive director, and that's going to feature various members of the Marijuana Advisory Committee, as well as the State Board of Pharmacy and the Ohio HIDA. The goal of that panel conversation is to review some of what we know will happen in September when implementation of the medical marijuana program happens here in Ohio, and to provide an opportunity for all of you and any attendees to ask questions, to raise questions or concerns about sort of how this is rolling, what we need to know, and what we can take back to our local community. So that should be a good about an hour and 15 minutes for us to engage with these key stakeholders and get a little bit more information about what to expect. So I wanted to highlight both of those, encourage any of you who have someone from your coalition attending to really pay attention to these if marijuana is something that your community coalition is heavily focused on. We've also got with us today, I'm very excited, one of our guest speakers is actually here to talk a little bit about and give us a teaser for alcohol and regaining traction. We have talked multiple times on this webinar and in our SPECA meetings about the importance of not forgetting about alcohol. Just this past year, we had alcoholic ice cream slip through into a budget bill. And as we continue to really work on so many different fronts of prevention here in Ohio, making sure that we don't forget sort of the route that where many of us started and where we're going is certainly a key one. So with that said, I'd like to turn this over to our good friend Deacon to let him give us a little bit of a teaser and to ask some important questions I'd like you to carry forward in your day. Deacon.
Well, good morning, everybody. I almost said good afternoon. It is a little chilly. I'm probably like many of you. I'm so ready for spring. It's not even funny. So the purpose of our conversation on Tuesday morning is to really get an understanding and a reminder of where we came from as a field around alcohol policy. Where is it that we gained traction? Where is it that we lost some traction? As well as where is it that we can build off of our past success and past challenges? And so some of the questions we're going to be answering over the course of our time together really do focus in on where we've been. And sorry, I'm trying to advance the slide. There we go. So really look at alcohol policy over time. Why do we have a 21 drinking age? You know, what's the rationale behind it? Because so many times we get beat up around it. You know, legal age of drinking should be 18 or it should be 19. You know, they can go to war, but they can't drink. So why was 21 even chosen? And you know, looking at this notion of normative environments, liquor advertising. Has there always been advertising on television for things like Jim Beam or Jack Daniels? If not, why do we have it now? What happened? What changed in our environment? Why is it that we seem to be doing a lot of stuff on alcohol policy? Why is it that everybody is addressing underage drinking? And have we always been able to use our federal funds to engage in alcohol prevention? And then really looking backwards and, you know, answer the question, what has been done in the past and really what's worked, and quite frankly, what's not worked, and what opportunities those challenges present to us today. And then really looking at, you know, policy strategies. If you can advance the slide, please. Really looking at what effective policy strategies are. Do we really know what makes a difference through policy, right? Do we really understand how policy has been done, what hasn't been done yet. What can be done to make the state enforce the liquor law? Are there things that we can do on the local level? Are there things that only the state can do? And how do those dovetail? And which is more effective? You know, so many times in our world, in prevention and in coalition work, we really do want to be the nice people. We want to bring people along, doing nice things, and so we do a lot of stuff around. Oh, if they would voluntarily do this, you know, we're gaining traction. But when do we stop that? When do we rely on mandating something versus asking nicely and hoping that they're going to do something different? And then really ending our conversation together with what we're going to talk, what's on the next slide, which is really was emerging issues. You know, some things that we're seeing nationally as well as in our state is that people are going to less people are going to bars to socialize. And what does that mean for our field? How does that look? What does it mean when we take people out of the public eye and put them behind closed doors? How do new adaptive technologies affect best practice, especially around carding? You know, how many of you have gone into a store and, you know, been asked to scan your ID, or they'll bypass age verification? So there are adaptive technologies making our jobs harder in the world of prevention. And then what happens when convenience shopping and alcohol sales collide? Think about the click list. Think about home delivery of food. Think about some of the stuff happening with Whole Foods and Amazon's desire to be able to get products on people's doorsteps. How does that affect our work? And what does that mean for not only access, but also the normative environments that we see around alcohol? And how do we truly establish that new norm? These questions and others will be answered and discussed during our session first thing Tuesday morning. And I hope to see all of you there. And hopefully I'll see some familiar faces and meet some new people as well. So thank you for listening to me for this brief 5 or 6 minutes this morning. Thank you.
Thank you, Deacon. And if I can ask you just kind of one follow-up question. We've talked quite a bit here at Prevention Action Alliance about the need to continually bring this topic up. And if I can ask you, would you just address whether or not it's important for us not only to speak about the need to enforce the alcohol-based standards, but also to make sure that we are engaging parents in this conversation? And will you be addressing that at all in your speaking point?
Yes. And so one of the questions was, what does it mean when we have less people going out to socialize and pushing? Essentially, then they're staying home and having, you know, parties and having barbecues, and, you know, what does that look like from both a parental standpoint as well as a near peer? You know, when we have older adult children at home that are of drinking age, you know, around kids who are not of drinking age, and how does that increase access and availability in a non-regulated and, quite frankly, a harder to enforce environment? In addition to that, what does it really look like? What does the research actually say around parents teaching their kids, quote unquote, how to drink? There's new research that came out of Australia that we'll be highlighting a little bit that shows that we've been right all along. You know, over the course of 6 years, in 2,000 people in Australia, they determined that if we teach kids how to drink and give them alcohol under the legal drinking age, they drink more, have more problems, and seek alcohol outside of their own home before they're legally allowed to. And so it's some validation for our work, and really looking at how that normative environment's changed and what it means when you have more people drinking in home versus going out to drink, and how that affects our families and affects parental decision making.
Great. Well, thank you so much. Really looking forward to this conversation and seeing the research that lists up what we do and what we've believed, and calls into question some of the ways that things are changing. So really looking forward to it. Thank you so much for being with us today and giving us a quick teaser for what's to come.
You are welcome. Thank you.
So moving into our next topic, I want to dedicate a couple of minutes to speaking about Legislative Day, which is coming up on the heels of Coalitions Rising. It'll take place on Wednesday, March 21st. For those of you who have already RSVP'd and sent in a request for assistance setting up your appointments, we have been working on those. Almost all of those have already been taken care of or are in the process of being shared with you. For those who have RSVP'd later at the tail end of last week or potentially yesterday, we are in the process of reaching out to you. So please be patient. We're doing that as best we can and trying to get in with those offices. In terms of the schedule for the day, as a quick reminder, this is a joint legislative day between the Ohio Youth-Led Prevention Network as well as the Statewide Prevention Coalition Association. So we're really excited to have not only youth coming with some of our coalitions that we've already been informed of, but we'll have some of our youth council members here as well from the state level, trying to offer a perspective from our local communities from a youth vantage point and to really drive some of those points home. So it'll be a great day. To alleviate some of the issues that we've had in the past with transportation, we have made one adjustment that we hope will be to everyone's benefit. Based on the participating numbers, we have contracted a bus to help us get to and from downtown. So if you are planning to participate in Legislative Day, whether you have been making your appointments on your own or we're helping you in that process, we encourage everyone to be at the Marriott University Columbus area hotel parking lot at 9:30 a.m. We will be taking off promptly at 9:30 and heading downtown to the Vernon Rice building. Now, if you have some concerns about that time delay, I encourage you to reach out to me. You can reach me here directly at the offices. I would suggest that you do so by phone today. At this point, we have ample space for everyone who has RSVP. If you've not already done so, just be mindful that at worst case scenario, we may have to still allow for additional support from the Prevention Action Alliance staff with transport and some of those things. But I do heavily encourage everyone to be there for the shuttle to make this a bit easier. We will be arriving downtown and going into the Rice building at approximately 10 o'clock. So we should be inside and establishing our kickoff meeting at 10:15. A general note on the day, especially if you are bringing youth or a large group. Lunch is going to be on your own. We will provide breakfast, coffee, water, all of those types of things that will be in the room throughout the day. However, for a larger lunch, you will have plenty of time between the blockades for legislative appointments to do that, to walk around, to explore a bit. And so we would encourage you to make sure that everyone brings a little bit of money with them, be prepared to do those things. Couple of points. Encourage any youth that are attending to avoid bringing any form of backpacks. They will not be allowed in the building. Make sure to wear comfortable shoes and have a photo ID. Those are just the basic needs that I would encourage every member of your party to take care of before they show up. Provided that the appointments all end within the window, we anticipate hosting a wrap-up meeting in the Vernon Rice conference room on the 19th floor, as you see there, at 3 p.m. And then we will all walk down together, catch the shuttle service back at approximately 3:30, head back to the Marriott, and let everyone get into their cars and hit the road before the rush hour traffic begins. So I hope that this will be a helpful way for us to move forward. I know that for those of you who may not have done it before, parking can be a little bit difficult this time of day in the downtown area. I know that there are a couple of different groups that are hosting legislative appointments on the same day that we are. So I would encourage everyone to be there, be early, communicate with our staff here, let us know that you'll be around so that we can make sure we get any updates to you, and certainly reach out with any questions. In terms of some of the documents to support your planning purposes, we have already sent out a couple of planning templates, some legislative talking point templates, and those sorts of things to you. But we will be resending those again on Wednesday, tomorrow, just so that folks can kind of take a last-minute look, make sure that they're preparing with about a week to spare. So again, if you have any questions, let us know. Do not hesitate, but I hope this provides a little bit of insight into the best way to plan your day, and make sure that this is going to be a great day for SPECA and for the Ohio Youth-Led Prevention Network. We're certainly very, very excited. And after that, the next date that I want to just remind everyone to save is May 15th. That will be the annual SPECA annual luncheon, membership luncheon. We are currently in the process of providing or of securing the appropriate venue for that. It will be a catered lunch. It will be free to all members. And we'll be publishing those dates. We are very excited for this year. We're going to have some guest speakers coming in. It's going to be a good day, and certainly a way for us to celebrate all the great work that's been happening this year and all the different places that we've been going and speaking and advocating for our local communities. So please make sure you save that date, May 15th. More information will come, but it will be a great day, and we hope to see everyone there if we don't see you next week at Coalitions Rising. So at this time, I'll leave it open for questions. So far, I've only gotten one or two, and those have been mostly logistical. I think I've addressed those. In terms of expectation, many of you noted in our previous legislative alerts that we would resume our typical weekly legislative alerts beginning next week. So you can look forward to those updates coming from Marcy Seidel, our Executive Director. In the interim, if something comes up, if you are looking for information or resources, reach out directly to our main line here at Prevention Action Alliance, and myself or the Assistant Executive Director, Fran Gerbig, will be happy to help you as best we can. All right. Thank you guys so much for joining us. A little bit of a shorter day today, but we'll give you a few minutes back of your morning. We're looking forward to seeing you all next week, and stay warm out there, everyone. Thanks so much.